Obesity is a great problem in the United States and the world. It is estimated that 1 out of every 3 Americans is obese with a BMI or body mass index greater than 30. Unfortunately, lifestyle modifications fail to address the magnitude of the obesity problem. Medications that target obesity either have marginal benefits or unacceptable side effects to be applied for the majority of our population with this disorder. Bariatric surgery, such as gastric bypass or sleeve gastrectomy, while showing the most promise in achieving sustained weight loss, is a very aggressive intervention. These surgical procedures come with the risk of complications, scars, and large costs. In the field of gastroenterology and specifically endoscopy, we now possess the tools to replicate the benefits of surgery without actually using surgical methods. There are no scars and no incisions. These outpatient endoscopic procedures are minimally invasive. The patient is usually able to resume her activity shortly after the procedure. These procedures can be applied to the patient with a BMI of greater than 30, who would otherwise not be eligible for the surgery, and also to the patients who are eligible for the surgery but are afraid to undergo surgery. For the primary treatment of obesity, we now offer the endoscopic sleeve gastroplasty, or ESG, or the endoscopic sleeve. We endoscopically reduce the size of the stomach in a fashion similar to the surgical sleeve gastrectomy. We do this endoscopically by using a suturing device. With this procedure, we are decreasing the size of your stomach by suturing it from the inside, from a big sac to the size of a sleeve. No surgery is utilized. There is no cutting. We insert an endoscope through the mouth. On top of the endoscope, we have a sewing machine that allows us to take your stomach and invaginate it on itself. This reduces the capacity of the stomach by approximately 70%. Once this procedure is completed, the stomach is much smaller in size. It can accommodate smaller meals only. In addition, the rate at which the meal empties from the stomach is reduced. Therefore, smaller meals last for a much longer period of time, thereby producing satiety for a long period of time. The patient will be able to follow a low-caloric diet without feeling hungry all the time. The procedure is designed to be permanent. We do not remove these sutures. Unlike the surgical options, we are not cutting or removing any part of the stomach. The stomach stays in place. We are just invaginating it from the inside. Another way to look at this is that we are closing off a part of the stomach with sutures, thereby reducing its size. Therefore, the risks with this procedure are rare. There is some abdominal pain and nausea within the first week or so. These are managed with pain and nausea medications. The vast majority of the symptoms resolve within the first week. The more serious risks, like bleeding, infection, or tears within the stomach, are very unlikely. How much weight do I expect to lose with this procedure? Well, on average, people have lost 18 to 20% of the total body weight during the course of the first year following the procedure. The weight loss is gradual, progressive, and sustained. The key to the success of this procedure is adopting a healthier lifestyle over the long term. To allow you to do this, we will provide nutritional counseling for 12 months following the procedure. This will help you learn how to adopt a healthier lifestyle. In the long run, the progressive and sustained weight loss afforded by this procedure will improve sleep apnea, blood pressure, diabetes, the wear and tear on the knees and hips, and reduce the risk of developing certain cancers.